Hi, everybody. I'm Dr. Michael Richman, a double board certified cardiothoracic surgeon. I've been asked by several patients to do a video about restless leg syndrome. Unfortunately, when I look on social media, there's more nonsense and misinformation about this condition, and everybody's trying to sell a product or their book as a cure. I don't think this should be a surprise to anybody because this is what all these medical influencers and fake doctors do. So today's talk is going to deal with the facts and the truth. Okay, what is it? Restless leg syndrome, also known as Willis-Ekbom disease, is a neurological disorder characterized by the uncontrollable urge to move one's legs. And this is often accompanied by uncomfortable sensations. For those who suffer from RLS, these symptoms typically worsen during periods of inactivity, particularly in the evening or at night, leading to significant disruptions in sleep and their overall quality of life, mostly because they don't get great sleep. And the condition has only recently gained widespread recognition. Its roots can be traced back over a century. So the first descriptions of what we now recognize as RLS emerged in the 16th century, believe it or not. However, it wasn't until the late 1940s that medical professionals started to differentiate this condition from other disorders. So then, in 1945, a guy by the name of Carl Axel Ekbom, who's a Swedish neurologist, articulated the syndrome in a seminal paper that detailed the unique characteristics of this disorder. And that's key. It's not the same as any other disorder. He described a pattern of discomfort in the legs that prompted a compulsion to move them, particularly in the nighttime hours, and theorized that a strong connection to sleep disturbances occurs. This work laid the groundwork for the future understanding and the current classification of this condition. Diagnosing RLS can be a nuanced process, as it is often mistaken for other medical issues, such as muscle cramps, which they are not, or arthritis. Healthcare professionals typically employ the criteria currently that's established by what's called the International Restless Leg Syndrome Study Group, which requires that people meet the following criteria. Okay, so 1, an irresistible urge to move the legs. 2, the onset of symptoms during periods of rest or inactivity. 3, symptom relief through movement. And 4, an increase in symptom severity during the evening or nighttime hours. Moreover, to rule out secondary causes of these symptoms, doctors may engage in a comprehensive evaluation. Like any medical evaluation or seeing a doctor, this includes a mandatory review of the patient's medical history, a physical exam, and possible lab tests to assess for conditions that may contribute to RLS, such as iron deficiency or kidney dysfunction. In some cases, patients may undergo a sleep study, which is called polysomnography, to measure their sleep cycles and the presence of additional sleep disorders. So, as our understanding of RLS deepens, so too does our knowledge of effective treatments. Okay, in the 2000s, early 2000s, various medications were FDA approved for the treatment of RLS, revolutionizing care for many. The initial pharmacologic approach typically includes dopaminergic agents such as Mirapex and another drug called Requip, okay, which are commonly prescribed as they increase the dopamine levels in the brain. And what that does is it alleviates the uncomfortable urges and sensations associated with RLS. In addition to these what we call dopaminergic drugs, the FDA also recently approved something called Horizon, which is a long-acting gabapentin or an extended formula. You know, obviously a lot of you may have used gabapentin before for neuropathic pain, and it has shown efficacy, the long-acting version, in RLS, particularly in alleviating symptoms throughout the night for patients whose symptoms are resistant to these medications. In recent years, the approach to managing RLS increasingly emphasizes the importance of lifestyle changes and adjunct therapies, which means other therapies, ensuring adequate sleep hygiene, engaging in regular physical activity, and avoiding stimulants like caffeine and nicotine are often recommended to help mitigate symptoms. Some patients do find relief through leg massages, warm baths, or using heating pads on their legs. Basically, whatever works. None of that's harmful. The holistic strategy underscores a broad understanding of this condition, wherein treating RLS goes way beyond mere medication, but it doesn't involve somebody's supplement just because they say so without credentials to explain why. Okay, so with that, I hope you learned something today. Thank you for listening. For more information or medical guidance, you can go to my website at www.paladinmds.com, and I hope everybody has a great day.